Welcome to Distrust and Disparities, Dismantling Black Health Disparities podcast. We examine health disparities that disproportionately affect Black women and Black families. In addition, we amplify organizations and individuals working to dismantle racist health practices and systems to improve health outcomes for marginalized communities. I'm your host, Jasmine Moore, a registered nurse, and I'm joined by my good friend and co-host, Camille White.
The state does not want to deal with the very real and tangible need of its citizens for medical care. For the most vulnerable people in society, which are children.
In this episode, we discuss how states refusing to expand Medicaid coverage leads to severe harm and death of individuals unable to afford health insurance. And we highlight Cover Texas Now, a coalition fighting for a sustainable healthcare system in the state with quality, affordable health coverage for citizens.
Welcome back to another episode of Distrust and Disparities. We are back and very Black. And we just want to reiterate, we will continue to come on here and tell our stories and advocate for Black women and also for ourselves. We plan to channel our frustration into our art, into each episode, into this podcast as we have been doing. We will continue to call out racism in the healthcare field and highlight organizations that are making true change in our communities.
Yes, it's like you said, we are back and we are very Black as we always have been. And we will continue to make this like a safe space for ourselves and our listeners who are wanting to learn about everything that's going on in specifically the healthcare field and disparities affecting, our community. But, when we talk about stuff, it's also affecting other people of color as well. And, given, as you even said, the political landscape and sort of this future we have ahead of us that is sort of unknown and filled with a lot of fear for, our communities and other marginalized people, know that there is still hope and that we will try to highlight organizations that have already been doing this work and will continue to do this work to make sure that we all have some sort of future that is filled with the things that we have been fighting for decades. It can be very disheartening, a lot of stuff, but there are people out here doing the work. They're continuing to do the work. They're gearing up, find your community, find you support within people that, stand for the things that you stand for, because we need to work together to get to where we want to be.
Exactly. Well said. And we'll probably have an episode, like our next episode, just talking about the year, what we've enjoyed and, what we look forward to in the future. Like you said, there's hope out here. We have power. We are students of history. We're going to look at what our ancestors, the people that came before us, the people right now, what they're doing, and we're going to continue to build upon that no matter what. And with that being said, today's episode is really timely and also highlights how politics can interfere with people having access to the basic right of healthcare, like basic healthcare. And we want to talk about something called the Medicaid gap. And before we jump into everything, we first want to clear up the difference between Medicaid and Medicare and give you a brief history lesson on the Affordable Care Act. So Medicare and Medicaid sound very similar, but they're different. And even I'm guilty of sometimes using the two terms interchangeably because they sound so much alike. So, Medicare is federal health insurance for people 65 or older and some people under 65 with certain disabilities or conditions. A federal agency called the Centers for Medicare and Medicaid Services run Medicare. Because it's a federal program, Medicare has set standards for cost and coverage. This means a person's Medicare coverage will be the same no matter what state they live in. Medicaid is a joint federal and state program that helps cover medical costs for some people with limited income and resources. The federal government has general rules that all state Medicaid programs must follow, but each state runs its own program, which means that eligible requirements and benefits can vary from state to state. On March 23rd, 2010, President Obama signed the Affordable Care Act, ACA, into law, making a significant overhaul of the U.S. healthcare system. The Affordable Care Act is a comprehensive reform law that increases health insurance coverage for the uninsured and implements reforms to the health insurance market. So prior to the Affordable Care Act, high rates of uninsurance were prevalent due to the unaffordability and exclusions based on pre-existing conditions. Additionally, some insured people faced extremely high out-of-pocket costs and coverage limits. The Affordable Care Act aimed to address these issues, though it did not eliminate all of them. And we want to highlight a fundamental change with the Affordable Care Act was the introduction of regulated health insurance exchange markets or marketplaces, which offer financial assistance for the Affordable Care Act coverage for those without traditional income sources. So basically people who did not get coverage through their job, they could go to the Affordable Care marketplace to get their insurance. Medicaid expansion is one of the most impactful provisions of the Affordable Care Act. Medicaid was extended to people with incomes up to 138% of the federal poverty line. And the federal poverty level in the U.S. is about $15,000 for a single individual in 2024. In the years leading up to the passage of the Affordable Care Act, about 14 to 16% of people in the United States were uninsured across all ages. By 2023, the uninsured rate had fallen to a record low of 7.7%. And most of the gains of people getting insurance came through the expansion of Medicaid. So more people were able to qualify for Medicaid, and that significantly brought down the number of people uninsured. So let me break some more things down. So stick with me. Stick with me.
It's a lot of information, but it's important to really understand, like, you know, what we then end up talking about, the main story and stuff, because, like, we were moving in the right direction. Things were happening and we were moving in the right direction. And so many more people now had health insurance coverage.
Yes. And we're going to talk about like the benefits and the significance of this. This is a huge jump. 14% of people not having coverage, that's like millions of people not being covered, people going without basic care, not getting preventative routine maintenance. So by the time they get to the hospital, they're sick. A lot of things that could have been caught earlier, they are not caught. Your emergency departments are filled with people coming in for things that they could see like a primary care doctor for. Hospitals aren't being reimbursed for the services that they're providing because people don't have insurance. Also, people are being hit with medical bills when they do go, and then if they can't pay them, so it's like people can be hit with medical debt. Hospitals aren't being reimbursed for like the services that they're providing. It's just a lot. And the Affordable Care Act originally expanded Medicaid to all non-Medicare eligible individuals under age 65 with incomes up to 135% of the poverty level. However, this is America, and you're not going to force us to do anything for the greater good, even if it means people can access basic care and suffer from preventable diseases. No, we have the right
to be ratchet.
Right. Right. To choose to let people suffer, you know?
Yes.
To choose to turn down money to help people.
To help our own. We'll still take money to then go and murder other people. But oh no, we're not gonna maintain funds that could then give people basic care, basic health care. Never us. You never gonna catch us doing that.
Never just accept something that's good for it. No. Without a challenge, no. No. To make things plain and simple, the Affordable Care Act was challenged in the Supreme Court, and it was decided that states could not be forced to expand Medicaid. The federal government cannot enforce the law, and effectively, Medicaid expansion is optional for states. Optional.
Because, people will choose to actually inflict more harm on people that they claim that they're representing their citizens and they're doing what's best for their interest. No, you're not. You just collecting coins and, from lobbyists and other corporations, and you're just like, the poor people, they don't have health coverage. Oh, well, for them. That's pretty much what it is.
Right. And research shows the impact of Medicaid expansion, and it's pretty extensive. So this includes people have better dental health, lose fewer teeth to decay. Teens have improved access to contraceptives, which reduces their chances of unintended pregnancy. Pregnant people have access to postpartum coverage after childbirth for longer periods, which contributes to lower maternal mortality and morbidity rates. And children who age out of the Children's Health Insurance Plan, CHIP for short, are less likely to lose insurance as they become adults. And I just want to read this quote from Adam Searing. He's a research professor at George Washington University. He says, by and large, there are just huge benefits for people who get coverage. Health is the building block for a lot of success, whether it's in work, family, society, or your job. And beyond health impacts, people in states that have expanded Medicaid experience less financial pressure. Study shows that there are lower rates of evictions in the counties that have adopted this expansion. And then another quote, it says, when you expand Medicaid, the increase in financial security for many families goes up significantly. That means they can make their car payments, they can pay their rent, they can continue to go to the restaurant down the street or buy toys for their kids at the local store. So it helps families with their financial security, being able to focus on their primary basic needs. And it also supports the economy as well, because they're not worried about taking care of like their health, you know, choosing whether to pay rent versus pay insurance. It gives a lot of security and it shows benefits for everyone. And I would say one of the biggest benefits is the federal government covers 90% of the cost of Medicaid expansion. That's the biggie.
It is. That is huge.
Right. It's not like we're saying you do this and pay for it, you know, your own. The federal government is like, we'll cover 90% to expand it so more people have access. So I just want to put that out there, you know. So at the beginning of 2024, 40 states, including the District of Columbia, had expanded Medicaid. 10 states have not adopted the expansion, and they include Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming. So if you have any listeners in these states, your government has decided they don't want y'all to reap any of these benefits that we just talked about. Except for, I think, Wisconsin. I was doing some research. They said they expanded their Medicaid on their own up to 100% of the poverty line. It's just a random fact from my research that I remembered. So Wisconsin, you know, they took their own route. The remaining states that have not expanded Medicaid have an estimated 1.5 billion people that fall into the so-called Medicaid coverage gap. This means that their incomes are too high to qualify for Medicaid, but too low to qualify for any of the Affordable Care Act marketplace subsidies. So this means many can't afford the premiums and other out-of-pocket costs on employer-sponsored insurance either. And like we said, Medicaid expansion covers those making up to 130% of the poverty line, which is about $15,000 a year for an individual. States that have not implemented the expansion have uninsured rates that are nearly double. So they remain at 14% compared to those who have expanded it at 7.5%. And this translates into people without insurance coverage typically have worse access to healthcare than those who are insured. 1 in 5 uninsured adults in 2022 went without needed medical care due to costs, and uninsured people are less likely than those with insurance to receive preventative care and services for major health conditions and chronic diseases. Compared to other adults, those that are uninsured typically have more disabilities. And I also want to highlight that among workers, like those that are working but don't have insurance, adults in the coverage gap are more likely to be self-employed or to work in industries such as construction, retail, and food services, where wages tend to be low and employers are less likely to offer health coverage. This is a big, huge part of the population. And I also want to point out adults in the coverage gap are also more likely to be employed in caregiving occupations such as childcare workers, home health aides, personal care aides, and nursing assistants. This is really disheartening. Like, people are working and they can't afford health insurance. They can't get a break to get assistance. And these are heavy jobs. Like, you're on your feet all day, you're running around, you work long hours, especially in like the caregiving occupations and even like construction, retail.
Yeah, these are occupations and careers that are like the backbone of any sort of society, where like if you don't have these people in like the best shape possible, then like things fall apart. If these people decided to not even do these jobs anymore because of the fact that like they're just one treated so poorly, or two, they're not even expected to make a living wage, then things would cease to function. And I think people always take that for granted. And then people fight back against unions when like unions are there to help them get, you know, the living wages they deserve, also to include health coverage. And all of these people that fall into these categories with these jobs is just like, and we're just like, oh, figure it out. Oh, well, like you'll have terrible health. And then it'll be a question of, oh, why does no one want to work in this career field and that career? Because they're treated like shit. And then when it comes time to getting any sort of preventative care, like they can't afford it because they don't have health coverage. And then it's just this whole terrible cycle. And it just is really telling of like, you treat people who, I think some would be like, oh, they're the lesser, but like really they're the backbone of most societies. And like we need people in these jobs, but they need to be respected and they aren't.
Exactly. And they need to have access to healthcare and an affordable wage. They need security. And some people look at it as, oh, if they raise like the pay for people at these certain jobs, they're like, oh, but I'm only making this. But we need to advocate that we all be paid fairly and compensated for what we do. The wages in the US have been very stagnant. And if we look at some of like our policies and things like that, they're benefiting corporations so that they can get greedy and they can get richer and things like that. So we need to look at the whole system as a whole, but that's a conversation for another day. But we thinking about it and we putting the pieces together. We are. And we want to highlight some of the racial disparities as well. People in the coverage gap are disproportionately people of color. Nationally, people of color make up about 65% of the people in the coverage gap, compared to 43% of people in the US. Black and Latino people are particularly more likely to be in the coverage gap. Black people making up 24% of the coverage gap, and Latinos 35% of the coverage gap. And I want to point out, Black and Latino people are also more likely to have incomes below the federal poverty level and more likely to be uninsured. And these factors are closely connected to structural racism, which reduces their access to employer health coverage. And a major reason for these disparities is that states with relatively large populations of Black and Latino people are particularly in states that are in the South, and they are less likely to have expanded Medicaid. The 10 states that have not adopted expansion, I believe 7 of them are in the South.
Have you checked out our website? There you can find all of our episodes and show notes. You can even listen directly on the site and catch up on any previous episode you may have missed. You can read our bios and see what we're up to. Also, we made it even easier to contact us. Just fill out the form on our homepage and click submit. We invite you to recommend guests and topics we should feature. So what are you waiting for? Go check us out at distrustanddisparities.com. This week, we want to highlight an individual from Texas who suffered the consequences of living in the, quote, Medicaid gap. So Millicent McKinnon of Dallas went without health insurance for years. And she is one of roughly 1 million Texans who earned too much to qualify for Medicaid in the state, but then too little to buy her own insurance. And most of these people work in jobs that just don't offer affordable health insurance. So Millicent was a descendant of runaway slaves who settled in Chicago. And as an adult, she moved to Dallas and worked in healthcare her entire career. And her last job was as a home health aide, taking care of the elderly and people with disabilities. And her daughter-in-law stated she didn't make a lot of money and she didn't get health insurance, but she tried everything she could to maintain a healthy lifestyle. But when she started to feel sick, she put off going to the doctor as long as she could. When she realized that something was wrong and she went to find out what it was, it turned out that it was stage 4 breast cancer. In the year after her diagnosis, she bounced around hospitals and doctors would stabilize her and then send her home because without coverage, consistent treatment was hard to find. And her family looked for insurance but found nothing. And all they could do in the end was be there as she slowly died. In 2019, at the age of 64, Millicent passed away. And she was months away from getting Medicaid. And this was a month before her granddaughter was born. And she just wanted to meet her granddaughter. And this is just such an unfortunate story because Millicent should still be here. And she should have had access to affordable health care. And we wanted to highlight her story because she is one of the many working class individuals that can't afford access to health insurance. Home care workers, including home health aides, personal care aides, and nursing assistants, provide necessary care for older adults and people with disabilities. They form the backbone of our long-term care system by helping people with the task of daily living, but typically earn far less than a living wage and rarely have access to health coverage through their employer. And more than 1.1 million home care workers across the country are enrolled or could qualify for Medicaid coverage if their state chose to accept federal funds to cover low-income adults. Like, they could literally have the coverage. They could literally not be put in these situations where you're just, doing your best to live a healthy lifestyle and avoiding going to the doctor as long as possible because you're afraid of what the cost might be. You're afraid of going into medical debt because you can't afford it. And it's really ridiculous that people are working in the healthcare field, yet their employer does not offer them affordable health coverage. How are you providing medical aid to other people, but yet you can't even get that for yourself? Make that make sense.
It's a shame. And a lot of these companies, they try to get out of it, or they provide like subpar benefits, or they make it so expensive that people cannot afford it. And then if you're not paying people a living wage, like you said, working as an aide or a home health attendant, I believe we talked about it in a previous episode. It's a lot of work. You're on your feet. You're moving people that may not be able to walk or do things for themselves. They deserve a living wage. They deserve health care to be able to take care of themselves. Like it says, it's about 1.1 million home care workers across the country that if they lived in a state that expanded coverage, they could have health insurance. They can take care of themselves so they can help others, help other loved ones. It's just, this is crazy. Like, as a healthcare worker, you not being able to afford healthcare.
Insane. And so now we'll sort of get into the politics of Medicaid expansion, because, of course, it's all political. And the states that Jasmine named that have refused to expand are, all conservative states. So no one's shocked there, I'm sure. And it's like a big question because Millicent lived in Texas, but like, why won't Texas and the 9 other states expand Medicaid? And statistics show that nearly 3/4 of adults in the coverage gap are concentrated in 3 states in the South. 4 in 10 people in the coverage gap reside in Texas, which has very limited Medicaid eligibility and consequently a large uninsured population. And then an additional 19% of people in the coverage gap live in Florida and 12% live in Georgia. So in total, 97% of those in the coverage gap live in the South. And 7 of the 16 states in the South have not adopted the Medicaid expansion, and the region has more low-income, uninsured adults and higher uninsured rates compared to other regions. They really don't care about people.
But they quoting the Bible and
Oh, yes.
don't want you to have an abortion, but how you going to take care of this child? Like, once you have the baby, does that child not deserve to have health insurance? Because we're talking about children. It's not just working individuals. We're talking about families and children not having access to health care. That's not right. That's crazy.
It's not at all. It's not at all. And the eligibility requirements for Texans under Medicaid are some of the strictest in the U.S. So for parents and caretakers of kids who are covered by Medicaid, a family of 4 with 2 parents has to make at or below $285 a month to be eligible.
That's crazy.
4. A family of 4. You're like, you have to make at or below 285. What do you think a family of 4 is doing with $285? Oh my God, you are literally like, you have to be so poor in every way like possible. Like, you can't even feed a family of 4 with that amount of money a month. Are you kidding me?
Exactly. When you look at that figure, it doesn't make sense. And it just shows you why so many people are uninsured and don't qualify. $285 a month. This is for a family of 4. And 2 parents. Crazy.
It's insane. I'm stopping myself from cursing because I'm
right. I was trying to stop myself from interrupting you from reading the rest of it.
And adults in Texas who aren't caregivers, pregnant, have a disability, or are 65 years or older cannot access Medicaid. They can access insurance through the Affordable Care Act marketplace, but they must make above the federal poverty income level. It just these restrictions, you're literally like making it where people are going to suffer and die. It's so intentional. It's so intentional. And according to the advocacy and policy organization Every Texan, quote, this leaves most working poor Texas adults uninsured because the state's Medicaid program is closed to them and they cannot get sliding scale ACA coverage either. So why won't states expand Medicaid when it will help to provide coverage for millions of low-income Americans and the federal government will pay for 90% of the cost? And as Jasmine put, the simple answer is politics. Political hurdles are keeping most of the states from adopting legislation to approve Medicaid expansion. Republicans and Democrats have fundamentally different worldviews of the program. Democrats viewed Medicaid as a health insurance program that helps people pay for health care, part of a continuum of coverage we have in our fragmented health system, which people move in and out of their life and economic circumstances change. While in sharp contrast, Republicans view Medicaid as a government welfare program. If you see Medicaid as welfare, you might want to impose work requirements to receive it, or cut it or cap it, or limit the number of years people can receive it. Moreover, if you see Medicaid as health insurance, you naturally support expanding the program to cover low-income adults who will otherwise be uninsured. But if you see it as welfare, you might not support or even openly oppose Medicaid expansion. Which again, it's like this whole mindset of like welfare. And it's very interesting, certain people, Republicans, conservatives, who view certain help as welfare, while others that are constantly given out to white people all the time is never welfare. They're giving handouts constantly. That's not welfare for them. But when it's something that would benefit, marginalized communities, people of color, all of a sudden it's welfare and they're just, just getting handed so much that like, no, we're not going to help them, which again is racist and terrible and ridiculous.
Mm-hmm. Exactly. And we can do a whole episode on this. I think I'll start researching it for the future. Just the propaganda around welfare and receiving benefits from the state. Once Black people weren't working for free and they were demanding a livable wage and, wanted support their basic access to rights. Now it's like, oh, we can't support people. We can't help people and things like that. Oh, they're taking advantage of the system. Like, you need all this rhetoric. You need to pull yourself up from your bootstraps. But then we have people, what comes to mind as you was reading this, the whole Brett Favre case, how he was taking Medicaid funds to build like a sports stadium and things like that. Like, people abusing the system, but that kind of gets swept under the rug. But let somebody, have to exchange their food stamps in order to maybe pay a bill or do something like this. Oh, that's all plastered over the news. So it's just crazy. And like we just pointed out in the beginning of the episode, there's so many benefits. Just having access to health insurance improves people's financial security. They're able to, work. They're knowing that their family's being taken care of. They can pay their rent. They're not choosing between basic care. They're not waiting to go to the hospital until the very last minute. And these are generalizations across about Democrats and Republicans. There are some Republicans in these states that are advocating for expansion, especially in rural areas, because hospitals are closing because uninsured are coming to these rural hospitals and they can afford to cover the bills and things like that. So this is forcing hospitals to close. And no matter people's party lines, when it comes to average citizens, research shows that 71% of the public wants to keep Medicaid in place. They support the expansion.
And here are a few sort of statements from people who are against Medicaid. They argue that many legislators in the states that haven't expanded say, well, we just don't feel that the government should be in the business of helping provide health coverage for folks. They should get it through their work. Which is then like, if that's the case, then you should make it where there are policies in place that force employers to provide affordable coverage. But no. Mm-hmm. And then they've also said, well, our Medicaid system is a government system. It doesn't work very well. And we don't think it can take more people being in the system. Are you ignoring the fact that you would get more funds to then help, cover the more people that would be in the system and provide more resources? I guess so. And then, of course, a lot of people, a lot of Republicans immediately think Medicaid expansion and then tie it to Barack Obama and it being a toxic phrase because, they don't want to see themselves as they're aligning with him in some way, which again, is just like, you would rather have people suffer and die than say boldly, or just not even boldly, quietly, that like you agreed with something that a Black president said. Right. Your racism is showing, honey. Your racism is showing.
Right. This whole Obamacare, because I was like looking up like Affordable Care Act and like Obamacare. So people were calling like the Affordable Care Act just Obamacare. And Republicans are like, no, we don't want anything to do with it. But I'm like, your constituents in these rural areas don't have access to health care. Their hospital that was an hour away closed. So now they have to drive 3 hours away to the nearest hospital. The doctors that work at these hospitals, they leave the community because they have to go get jobs. So this is creating huge problems. Like, I just don't get how you can say, I care for people, I support people, but when it comes to supporting legislation and laws that will support people, it's like, no. And on another thing, when your constituents want it, you're like, nah, y'all don't need this. What did that quote say? We just don't feel like the government should be in the business of helping provide healthcare coverage for folks. Well, why are you in government? If you don't want to support people, you don't want to help people, your constituents are saying this is what they need, and you're like, nah, F that.
Yeah, what at that point, what is the government for? And also, you can look at so many other countries that are very similar to us that literally provide health coverage for everyone.
Right.
As soon as you're born, it's just you got it and you're good and you don't pay like. And that is just such a wild statement. There's like the government shouldn't be covering that, and it's just like what?
Right. But you could take our tax monies and use it to buy bombs, buy weapons, things like that. I just don't get it. But when I want healthcare access, it's like, nah, you don't need that. You don't need that. You good. You good.
You good? Why don't you just go home and die? You good?
Right. It's crazy.
It's insane.
It's America.
Yes, this is America.
Right.
It'll let you know who she is each and every time in case you forget. This is America. And then circling back to Texas, so Governor Abbott and Lieutenant Governor Patrick, they are staunch opponents of Medicaid expansion. Abbott helped lead a successful lawsuit against the federal government to ensure states didn't have to cover more residents under Medicaid as part of the Affordable Care Act, as Jasmine mentioned, that Supreme Court decision. So,
Texas.
That was all
Texas.
And he also described expansion as a, quote, tax increase waiting to happen. And then the lieutenant governor used his position to prevent bills for Medicaid expansion from reaching the floor of the state legislature where, people could debate about it and decide for themselves, other representatives within the state. And given this political landscape, the prospect of the state government opting for Medicaid expansion to address this coverage gap appears highly unlikely in Texas, unfortunately. And it's just disheartening because there'll be more millicents. There'll be so many more. And it's so preventable. It's so preventable. Yeah. And the legislators' anti-expansion attitudes are not at all shared by the majority of Texans who generally support expanding Medicaid coverage in the state. A 2023 survey administered by the University of Texas at Austin found that 73% of Texas voters support Medicaid expansion, including 63% of voters who identify as, quote, strong Republicans. And despite widespread support for expansion, the state government has not budged. And this not only makes Texans unable to reap the benefits of increased Medicaid coverage, but also means that they are still supporting Medicaid programs in other states. Because between 2014 and 2024, Texas residents have paid a whopping $36.2 billion in federal taxes that have been used toward Medicaid funding in states that have expanded coverage.
That part. I should have bolded and highlighted that part. So even though your state won't accept the funds, your tax money is still going to support Medicaid programs, just not in your state. Isn't that crazy?
It's wild.
Like your federal tax money is still being collected and used for programs such as Medicaid, one of the largest things. But your state can't get any of that money because they're like, take it to the Supreme Court. No, we don't want it. We don't want it.
Refusing money to help their citizens is insane.
Right. And it's not like they're offering any alternatives, It's not like, okay, we're going to make it better. Like we see what's wrong. We're going to make it better. No, it's just like, no, we don't want that. Keep working and hope you don't die.
What a bleak life.
I know, I should be laughing, but it's just like, are you fucking serious?
Yeah. It's like, you gotta laugh to not cry. Cause
right. The mental gymnastics.
Right.
People do to support this.
Right. And it's just like, this 73% of Texans are like, we want this expanded. We want this. And you have a governor in place that's like, nah, no, you don't. You want to die and suffer. Nope.
Yeah. It's just, Like, this is just putting politics over people, over public health, over common sense. Like, your money is still going into that pot to pay for Medicaid, and they're like, nah.
And we're going to end this section with a few more quotes from Professor Searing from Georgetown University. Texas is a state that has the largest number of people who would benefit from expansion. When you get down to ordinary people who are trying to live their lives, they are generally very supportive of expansion, regardless of what side of the political spectrum they're on. So we really need to focus on the leadership in the states that haven't expanded, and political leadership is where the roadblocks are. And the reality is that every state where Medicaid expansion has been put on a ballot, it has been approved by voters. So, if they didn't have their governor and lieutenant governor blocking it, and then having other representatives within the state government, being able to get it as a measure, it would probably have been approved. But they're blocking it every chance they get because they don't care about you. They really don't. And there's another quote from State Representative Julie Johnson, who is a Democrat from Carrollton, Texas. Quote, "Healthcare is not a Republican or Democratic issue. It's a human issue." And it's just like, it's a human issue, and healthcare is a human right, as we have said many a times. And this should not be something that's being blocked by people who have been elected to run things and, for the betterment of all their citizens. Texas is such a large state, and y'all are just going, nah, we don't care about y'all. That's insanity. But there's one glimmer of hope for another state that has refused to expand, is that North Carolina is the most recent southern state to pass Medicaid expansion. So, maybe with that, other states can start, getting on board with actually helping their citizens, because it's so simple, and the money is still going to it. Your money, your federal dollars. So if you live in those states, you need to be paying attention to what your elected officials are doing, because it's there. They're just literally going, nah, we don't want that.
Yeah, if you or one of your family members, you live in the South, in the rural South, a lot of the rural hospitals are closing. And this can start to happen to a lot of the major hospitals. They can become underfunded as well. We're seeing a lot of hospital closings. Is it in the rural areas the hardest, but it can eventually trickle down. This is, like you said, a human issue. That's all it comes down to. And it just pisses me off. It's just like, this is so stupid. Like, this is what we're going to waste time on.
Right. A whole lawsuit to be like, nah, we don't want to do this. We don't want to help people. The statistics are there. The evidence is there. People are being harmed. And you continue to play in the faces of your citizens. If you are enjoying this episode, you should consider buying us a coffee. Yes, a coffee. That small gesture will help us continue to create quality episodes and content. Click the Buy Me a Coffee link in the show notes, or check out our website at distrustanddisparities.com.
As we segue into our segment where we highlight organizations that are working to dismantle the system, that are working to bring about change, Texas is home to an array of advocacy groups aiming to engage policymakers and foster the support to bring Medicaid expansion to their state. And one prominent organization is Cover Texas Now. It's a coalition of consumer and faith-based groups advocating for healthcare reform. So in 2021, more than 188 grassroots, community-based, and medical organizations united with Cover Texas Now to urge their state officials to expand Medicaid. So if you live in Texas, know somebody that lives in Texas, share this episode with them. And you can go to covertexasnow.org, and they have a petition. They have a link where you put your name and you can send out an email demanding that your state take action and support Medicaid expansion. The link is set up to send email messages to your state senate and also your governor demanding coverage for all. And if you live in any of those 10 states that have not expanded Medicaid, please go look at what your lawmakers are doing, what those that you voted for to represent you, see what they are doing to expand Medicaid and how you can support those efforts. And also, one other thing, if you live in a state that has expanded Medicaid coverage, I know the enrollment for the Affordable Care Act in most marketplaces, they're open now, or they'll be opening in December for you to get coverage for 2025. Even if it's like your employer plans, please look at those plans and elect, the appropriate coverage for yourself and your loved ones. So just want to send that reminder out as well. Take advantage of the benefits that you have while you have them. And we'll be closely following this Medicaid expansion as we move into a new presidency. We're going to hear a lot of things. There's going to be a lot of attacks on, Social Security programs designed to help individuals in need, the people that are the backbone of our society, construction workers. Think about your roads, think about safety, think about measures when it comes to like food safety and things like that. People that are working in these industries, healthcare workers. We're going to be staying up to date as much as we can. As much as we can and tolerate.
Yes.
But
yes, the tolerate part.
Right. But I'm particularly invested in this Medicaid part because I work with individuals that, get Medicaid and they need it, to go about their daily lives to get access to care. It's already kind of hard to get people with severe mental illnesses to take care of themselves. So just creating more obstacles and hurdles, it'll directly impact them. It'll directly impact, my work and a lot of people. So this is something that I'm like seriously interested in and, want to support everybody having access to basic healthcare, especially like healthcare workers. We're all one. We all need to be paid a fair wage. We all need to have access to our health insurance plan because it's a big difference from the health insurance that I got with like when I first started working with the hospital compared to now. They're skimming and cutting away at everyone's benefits and making things higher. There's longer wait times for certain things and the whole system needs to be fixed. So let's do what we can.
Thanks for listening to this week's episode. Do you have recommendations for topics we should discuss about health disparities or injustices? Guests we should interview doing amazing health justice work, or organizations we should highlight creating positive change for marginalized communities. Please visit us at distrustanddisparities.com or email us at distrustanddisparities@gmail.com. Remember to subscribe, rate, and review us wherever you listen to podcasts. And follow us on Instagram, Facebook, Twitter, YouTube, and LinkedIn.